Hi, I'm David Blake Jones, the owner at Return of Function Acupuncture. I've had a great clinical success recently that shows the power of acupuncture to relieve pain and restore function. A patient who had been born with spina bifida and had walked since childhood with a limp recently presented with a chief complaint of severe pain in her right hip joint that had been diagnosed as bursitis. Her current pain was at a MYOP-2 rating of 5 out of 6. With 0 being no pain and 6 being the most severe pain. This pain radiated along her IT band. She had been suffering with chronic pain in this area for 5 years. The pain was made worse by walking, lying on the right side, and standing on the right leg. She also complained of pain in her right upper buttock, pain in her right hamstring and lateral right knee when driving. Secondarily, she complained of chronic lower back pain that was worse with bending. Based on manual muscle testing, palpation, and her presenting symptoms, I identified likely myofascial constrictions in left and right hip flexors, left and right TFL, left and right glute medius, right glute minimus and piriformis, right hamstrings, and right vastus lateralis. Given the exterior symptoms and her weak kidney pulses, I made a diagnosis of qi and blood stagnation and kidney yang and yin deficiency. Her treatment plan called for 4 treatments over 10 days to assess the rate of response, both local needling of motor and trigger points and distal needling of acupuncture points to release myofascial constrictions, mainly in the right side affected muscles. The local needling in this approach is supported by a recent study, Brennan et al., that showed dry needling, otherwise known as local acupuncture needling of myofascial constrictions, to be a non-inferior alternative to cortisone injections for greater trochanteric pain syndrome. In addition, the patient was provided instructions for stretching the muscles involved in her pain. After her first treatment, the patient reported immediate reduction in pain and she continued to enjoy a reduction in pain through her next 3 visits. Right before her 4th treatment, the patient reported even greater pain reduction in her right hip pain. The pain was now down to 1 to 2 out of 6 during the day and down to 3 out of 6 when lying on the right side at night. The patient reported that there was still some discomfort with walking and standing at work, but that it was, quote, not nearly as painful as before, unquote. In addition, the pain in her right hamstring and the knee while driving, and the pain in her lower back pain had disappeared. Based on these results, I will treat this patient twice per week for another month and then reassess. To complement the acupuncture, especially if the patient is unable to come in as often as intended due to the long distance from her home in my clinic in Atlanta, the patient has begun taking a customized Chinese botanical formula that will complement the blood-moving, analgesic, and anti-inflammatory effects of the acupuncture treatments. This formula contains a powerful pain-fighting herb called Yan Hu So. According to the E-Lotus Manual of Oriental Medicine, Yan Hu So has a strong analgesic effect that is comparable to morphine. A PubMed search for studies on the effects of Yan Hu So or formulas with Yan Hu So reveals animal and human research from clinical trials to one meta-analysis for cancer pain that suggests this herb has significant analgesic properties. In fact, according to one animal study, Hu et al., Yan Hu So is synergistic with electroacupuncture. This means that if you take Yan Hu So right before a treatment, it enhances the effect of the treatment. Her formula should also help her to have better quality sleep, as research suggests that Yan Hu So has a mild sedative effect. Due to this patient's congenital abnormalities, she will likely need to manage her condition with regular stretching, exercises, weight management, along with acupuncture and herbal medicine maintenance. To learn more about what acupuncture can do for you or your patients, please visit my website at AtlantaAcupunctureCenter.com and please see the references mentioned in the text below this video. Thanks so much for watching. Take care.